I'm a pretty unlikely warrior for trying to improve care for people with dementia. Back in 2018, I was a couple of decades into trying to build Starbucks into the caffeine juggernaut that it became. I joined that company back in my 20s, got very lucky, and got to take that magical carpet ride. But when it became time to do something else, like a lot of people in healthcare, I found myself with two parents in their late 70s living in rural Arkansas who had two near misses, independent near misses with our long-term care system that I frankly found scary and sad, really sad. And I decided at that point, maybe I lost my mind, but I decided that surely I could take my skills and try to shine a light on a corner of the healthcare system that I thought was urgently in need of some much, much more innovative thinking. So that's what I did. Shortly after that, I made the very unlikely jump from selling coffee to running a large assisted living company. And that is a pretty big jump for those of you who know the business very well. COVID would arrive just a few months later, and I got a front row seat, just like you did, for caring for the most frail seniors anywhere in the world at arguably the most difficult time in history for this group of people. Now, during that time, I had a lot of observations about the state of senior care, which, talking to this audience, you're going to know this very well. But I was shocked by many things. But the one that puts me here in front of you today is this. I was most shocked by the frequency with which we send our seniors with dementia to our emergency rooms and hospitals. It's hard to believe, although you all probably know it better than anybody else I've talked to recently, that every day thousands of seniors across America end up in the emergency rooms and ultimately get admitted simply because we cannot manage, and their caregivers specifically cannot manage symptoms related to dementia. Happens every day, all the time. And as a senior, we know that you're going to go to the emergency room sometimes. You all know that better than most. That orange line there is just an average senior without dementia, and the number of times they may end up in the ED over a course of months. That's a patient or a senior with dementia. Can you see that? There's a big spike there in red. And if I could describe that, seniors with dementia go to the ER 3 times more often than other seniors, okay? And it happens a lot earlier than we think it does. I think we oftentimes, when we think about dementia, we think you've got to be really advanced in that disease to really need all the more advanced care, but that's not true. You actually often need it very early. You can't see it in this slide. However, if you see a blue line there, that spike would be just over that blue line. It's dramatic how often a senior with dementia goes to the emergency room, and it typically happens in the months leading up to a diagnosis and the months just after that as a family tries to get their arms around it. But as you all know very well, the ED is the last place in the world you want to be if you've got dementia, because usually there's very little they can do for you, but you almost always get admitted. Now I'll tell you a story about a woman named Beth. Real story. Beth is 82 years old. She's in mid-stage in dementia. She lives in Seattle. And she's fortunate enough to live at home, probably taken care of by one of you. And her caregiver is her husband, and luckily her daughter lives right down the street and is able to help on most days. Now, not too long ago on a Tuesday night about 9 o'clock, Beth got aggressive with her husband. In dementia, we would call this agitation, and happens all the time. Her husband did not know this was going to happen because no one had ever told him, despite the fact that this is one of the most common symptoms at this stage of the disease. He also did not know that there are some tried and true things that you can do to calm Beth down and to keep her at home. Now, at 9 o'clock on a Tuesday night, he couldn't reach her doctor, so he did what most of us would do. He called the nurses at the local hospital who didn't know Beth, who didn't know her symptoms, who didn't know her condition or record. And they, what do you know, they suggested he take her to the ED, so he did. After 8 hours in the emergency room, 6 days strapped to a gurney in a hospital on Pill Hill there in Seattle, 2 weeks in a skilled nursing facility trying to build up enough physical strength to walk back into her home, and having spent $32,000, Beth finally got back home. More medicated, more frail, more confused than when she left. And unfortunately, seniors, and again, you all know this very well, end up following this cycle, leading this cycle multiple times over their struggle with dementia. And it's incredibly unfortunate. Now, I tried to solve this problem when I was working in assisted living. And what I realized, and this sounds incredibly dramatic, but it is 100% true. Very dramatic because I say it all the time, and it even surprises me every time I say it. There is nobody in America who knows anything about dementia. Do you all believe that? There's nobody in America who knows anything about dementia, even though some of us in the room may think we do. There are very few that do. And that's because we've never paid for it. We've never invested behind it. And I oftentimes think that we don't care very much about these seniors, or we would have way better infrastructure set up to take care of them. Now, I want to just talk about a few stats real quick. And just, I know you all know these very well, but maybe just to hit on some big ones. This tsunami that we keep talking about, it's already arrived. It's already here. The tsunami is here of these seniors who are getting this disease. And it's going to get a lot worse. We have a big volume problem. I'll just give you one statistic. At the age of 85, you got a 1 in 3 chance of having just Alzheimer's. That doesn't include all the other dementias that are out there. 1 in 3. That is remarkable if you think about it. And as you all know, those 75 million people who make up the baby boomers, and they're just getting ready to turn 85. So we are getting ready to have the largest group of seniors in the history of time with this disease. I'll also say that there's about 8 million people in America today, it depends on who you talk to, 8 million people in America today who have a diagnosis for dementia. There's another few million who have it who don't know it, because it's pretty hard to get a diagnosis, and I'll come back to that. And lastly, we've got a problem here that impacts a much, much bigger population because of that caregiver. Caregiving is obviously important over any chronic disease, but particularly in dementia. Because it's hard to go to work if you think your mother may walk out into traffic while you're trying to go to work. You're not going to leave home. And we know those caregivers, well documented, often decline as fast or faster than the patient they're trying to take care of. So we had a big problem. Let me talk about expense. Dementia is also the most expensive end-of-life disease there is. Does everybody know that? Is that surprising? Maybe not in this room. More expensive than COPD and cancer and diabetes and all of those because you live so long. It cost us in the United States about $350 billion to take care of those 8 million people last year. And that is expected to advance to well over $1 trillion over the next few years as we get many, many more of these people to take care of. Now, I'll just tell you why this is expensive. And you all recognize this very well. And it's exactly what I told you earlier. If you see that big bar on the left side, that's hospitalizations. These are fee-for-service Medicare real numbers from 2022 Medicare data. This is how they spent that money. An average Medicare patient costs about $12,500 a year. And a patient with dementia will cost somewhere between 2 and 3 times that, almost always because of hospitalizations. That's the opportunity. There are other bars there, including yours, that add to those costs. But if you get in front of that hospitalization, it takes out a lot of the cost over time. It's a remarkably expensive disease. Now, the root cause of, I'm going to skip that and just jump to this. The root causes of this problem are many. We got a volume issue. There's no doubt about that. I think we're all in agreement. I know you're seeing that in your businesses. But there are other root causes here, right? One is underdiagnosis. It is very hard to get a diagnosis of dementia in this country today. That seems hard to believe when I say that out loud, but that is very true. Primary care doesn't have the time. They don't have the capacity. They don't really want to answer all the questions that your family's going to present because they only got 15 minutes to get that diagnosis done. And oftentimes, they don't feel knowledgeable enough to actually deliver the diagnosis. So what do? They send it to neurology. And how many neurologists are there in the country? There are about 5, I think. They're really hard to find. Right now in Seattle, where I live, it's a 9 to 12-month waiting list to get on neurology's dance card. And it's getting bigger, and that is a really long time when you got dementia, 9 months. And that's going to get worse over time. There's no doubt about it. And by the way, I always almost hesitate to say this out loud, but I will say it. Oftentimes, neurology is completely unnecessary in the majority of dementia cases. PCPs send it to neurology because that's where they think it's safe. They don't know how to do it all the time, so they send it to neurology. You get imaging, you get all those things done. When really, if you have Alzheimer's, that diagnosis can be done today by us, by others, with a nurse practitioner, and gives that senior certainty to go home and get the care they need without going through all of that work. A couple other things. Lack of caregiver support. You all know this very well. We have never built an infrastructure that's actually specialized for these patients. And they are struggling. And I don't need to tell this room that. And lastly, dementia uniquely has an incredibly exacerbating impact on every other chronic disease you got out there. From cancer to diabetes to CKD, whatever it is, dementia not only makes those diseases more expensive, but it makes it much, much more complex, and that is well documented. I want to talk about the good news. The good news is, and I think this is what Michael asked me to talk about, is there are some really bright lights on the horizon here. UCSF here in California has done some really pioneering work over the last few years to build some models to actually take care of these patients in a much, much more effective way. They had a novel idea. They took collaborative care models that have been very, very effective in other places like kidney care and cancer. And they took a geriatric nurse practitioner, highly specialized in dementia, paired them up with a licensed clinical social worker and a care navigator, and put them together and wrapped around a family and made them available 24 hours a day, 7 days a week, and actually gave them access to full spectrum of care, from clinical to psychosocial to navigation and education, and then turned them loose. And the results of those care models have been pretty remarkable. You can see here, this is kind of an eye chart. But this is to make the point, is there has been some really good work that's been done that's evidence-driven, JAMA published. Now, we've taken that care model ourselves at Rippl. And I'm not going to make this a commercial for us because there are others doing it. But this model gave us confidence of a few things, because they proved with this model at UCSF that you could keep people out of long-term care much, much longer than normal in the not having that care model, that you could keep people out of the ED in the hospital, that you could lower caregiver stress and improve caregiver confidence, both really important triggers for what actually leads to an ED visit. And by the way, you can do all of this at less cost, way less cost than is being done today with traditional PCP models. Now, I can tell you, and I'll add to that, just to make it even better, UCSF also proved to us that you could do it entirely virtually, which, by the way, I've been very skeptical of at some points, that you could actually deliver fully virtual care to a patient with dementia and their caregiver and get great results. But UCSF proved that was possible. And I can tell you that is possible because we are doing it today in 7 states, and we have been for the last 3 years, getting very, very similar results. Pretty remarkable results, actually. This is our care model. Again, I'm not making this a commercial. There are others that are doing something similar, but this is unique. We are just beginning to get this innovative care out there. Again, using a nurse practitioner coupled with a licensed social worker and a care navigator, working with your clients, your patients, to really give them a full spectrum clinical to psychosocial to navigation and education in one comprehensive place in a specialty model. And we are getting great results. I think the most important thing we can say is this is the future for dementia. There is no other way to do it. As you all know very well, and I think this will be important to say, we have no choice but to be able to keep people at home. Having come from the assisted living business, I know very well that even if we wanted to put people into facilities over time, we're going to outpace that demand will outpace that supply by a factor of 30 over time. I mean, you are in the right business, there's no doubt about it, and we'd like to help you keep folks at home. That's what we have to do. And I think there will be really unique opportunities to work with clinical providers like us to do that. And we're working with some of you right now on the GUIDE model. Many of you know that the Centers for Medicare put out a new dementia model last year called GUIDE. It's an 8-year program. We're working with a few of you in this room to deliver that care as we speak. But the much bigger opportunity is really to take risk and to build clinical models that can be much, much more expansive beyond Medicare into Medicare Advantage plans. Why should you care? I'll just close with this. And I don't know that I have a perfect answer for why you should care, but I'm going to give you a couple of thoughts. First of all, this is getting ready to be an epidemic. I feel like I cheerlead this all the time, and oddly, very few people are paying attention. We sell mostly to payers and payviders at my company, but it's only been in the last 18 months where people have really begun to pay attention, to know their data, to know what's happening. And I still think it's very, very slow, and the tsunami has landed. And I can promise you this is going to be a gigantic part of your business if it hasn't already. And the caregiver expectations, the folks that are calling you for help, are going to expect you to have a much, much more specialty orientation and know what you're doing in the space. The second thing is, as I said earlier, I think there are a lot of new innovative models that are coming to market to work with you and other care providers to give much better care to your seniors and to keep them at home. I think all of the therapeutics news that's out there around dementia is great. It's probably the most positive thing that's happened in dementia pharmaceuticals in the last 20 years, but it will have zero impact on any baby boomer. I'm just going to say that again. It'll have very, very little impact on any baby boomer because all of those drugs, at least today, are designed for people that are roughly a little older than I am, and I'm 54. You got to catch it early or it has no impact. So we have got to create care for the boomers in a very big way. That is the future. The last thing is, and the part that I'm most excited about, is I think we can really help you with your teams. I think having run that large assisted living company for a while, I can see that sometimes we're better marketers than carers. And I think there's a big opportunity to get really, really good at this and that our folks will appreciate it. We've been working with Mass General Hospital. I heard Samir talking about Mass General Brigham, one of our investors and one of our collaborators. We have been building a really, really specialized training program to get them. I mean, there's nobody who knows more about dementia than that hospital, by the way. Been doing it for a very long time. We've got to get them really specialized care and integrated with clinicians like us. We can work together to give them the tools they need to keep that senior at home and not to leave them out in the field sometimes when it's really, really tough. We can give you better tools, and we look forward to working with you on that. And I think that will have a very big impact on being able to recruit people into this space. 95% of the folks who work at Rippl today have this disease in their family, including me. A few of us are actually active caregivers as we speak, and we are innovating here. We are going to make a very big difference, and we look forward to working with you. But get ready, because the tsunami is here. Thank you.
Thank you, Kris.